This podcast is part of the Frederick Podcast Network. Learn more at listenfrederick.com.
That's number one. You kind of reset me.
Painful, tender to the touch. May also
Same shoulder length, and the other.
Welcome back to another episode of the Real Health Podcast with Brandy and Amir. I'm Dr. Amir Rashidian, a chiropractor, and Brandy Rashidian is my other half and business partner and everything else. And today we're going to talk a lot about a very, I guess, sensitive subject and topic, but it's so important because I don't think most people know all that it entails, and but it's going to affect every one of us if we live to an older age. This is something we need to talk about and think about. But before we get into that, I want to tell you the Real Health Podcast is brought to you by the Frederick Podcast Network. It is found on listenfrederick.com and also on YouTube and Spotify and iTunes and wherever else you like to listen to your podcasts. Obviously, we'd prefer that you use the video side so you can so we can see you and you can see us. Of course, we can't see you, but we can pretend we can see you. And the Real Health Podcast is where we take all the latest information in mainstream media about wellness and health, disease, new discoveries. We kind of digest it for you and explain it and tell you what it means and how you can apply it to your life. The hope is that it'll help you feel better, get stronger, live longer, and feel younger. And I think our mission is to get more people away from unnecessary drugs and surgery.
Yes.
And I want to emphasize the word unnecessary because sometimes drugs are necessary, surgery is necessary. So I'm not saying don't ever have surgery and don't ever take a medication. I just want you to do it when it's necessary, and hopefully we can help you do that. I think that's our mission. It's just, and if you believe in that mission, partner with us. Just get on board and tell others about it. There's so many people that at the first sign of something, they go to a doctor who all that this doctor can do is prescribe medications, nothing else they do. And so they go, okay, well, let's try this med and that med. But that leads to a terrible downward spiral.
And that's not what medicine was built on. And that's the sad thing. If you go through the history of medicine, it was actually a way more holistic experience in the very beginning. It changed, and it changed because, unfortunately, because of money.
Yeah.
Which is usually the basis of that, especially when it can be a negative change like that. So yeah, I agree. Shouldn't be the first thing that we try. There's many other things. There's great supplements. There's other treatments often that can be attempted before medication and surgery. But
so think about this. There's a patient I met yesterday. We won't obviously name her, but she was having neck pain following a car accident. So 3 years later, she was going to an osteopathic doctor. The osteopathic doctor did manipulations on her neck. Never took X-rays. Never looked at the alignment. Never did measurements or calculated which bone needs to be adjusted and what degree and what angle and any of that stuff. He just started manipulating her neck. Well, after a couple of manipulations, she started getting pain that was shooting down her left arm. She ended up in 10 years after, 12 years after that, she ended up in a chiropractor's office. This chiropractor was doing decompression. He decided to do decompression on her neck and her low back simultaneously. I have no idea why any chiropractor would be compelled to do that. So it didn't help her. She started feeling worse. Ended up having lower back surgery. So now the type of lower back surgery she had was they removed pieces of bone to take pressure off the nerves of the spine. It's called a laminectomy. Well, while they were doing that, they nicked the dura mater, the dural sac around the spinal cord. So her spinal fluid leaked out. So a week later, after that surgery, she had to go back into the operating room and they put a patch. Well, the patch didn't hold. She leaked out again. She went back in for a third surgery. Meanwhile, her neck is still bothering her and she's still getting pain down the arms. So they decided to do an anterior fusion. So she went in there, they fused 3 segments from the front. And a few months later, they had to do a revision because it didn't hold or maybe the screws didn't stay. So they extended it to more segments. 2 years after that, she's still having pain down the arms. 2 years after that, she goes back in. They do surgery. This time they do a posterior fusion. They remove some of the bones in the back of her neck. So right now, parts of her neck, there's no bone. It's just the skin's covering, but there's no bone back there. It's just bones on the sides. They put rods on the side. They fused her from C2 down to T2. 2 years after that, she still has all the problems. 2 years after that, she goes back in. They did a revision on that posterior fusion, and they extended it to T4. So she is fused from C2 in the neck, upper neck, all the way down to the upper back, T4, the fourth thoracic vertebrae. Every time she has surgery, she's gotten worse. Now she's got pain shooting down both legs, pain down both arms, weakness in her hands, numbness, tingling, burning pain everywhere. She has to walk around with a neck brace. She can't sit for a long time. She can't walk. She can walk, but I mean, it's painful. So you go, don't go down that path. Now, finally, she's in our office. And it's because no one will touch her with a 10-foot pole. She went to Johns Hopkins. They did a CT. They said 2 of the screws are really close to nerves, and they're actually irritating these nerves. And she asked if they could remove those screws. She said, we're not going to remove it. The Johns Hopkins surgeons said, we're not removing those screws. We're not touching this.
Finally. I mean, sorry, but
the damage has been done.
Yeah, but every time they go back in, they create more damage.
Yeah.
And that's the challenge. And somebody finally realized that after how many surgeries? Like at some point, have to.
How can you? Gosh, I mean, you go, okay, maybe they don't know any better. What?
That's possible.
I just don't understand why they would put this lady through so much. She's only in her, I think, early 60s.
Yeah, she's young. And then that's not even taking into account like what going under so many times, all of that anesthesia does to the body. Is not taking into account the pain medication she's probably had to be on. It's not, do you know what I mean? And then let's extend it further, because it's not just what that does to that person's body. Now let's talk about, a level of depression that she may have because she probably feels hopeless. Now let's talk about the damage it does to the relationships in her life.
Following the last surgery, she had a pulmonary embolism. So that's a blood clot in the lungs. That can be fatal in a fairly large percentage of people. She survived that. She had 2 more pulmonary embolisms after. She's had 3 in the last 2 years since the last surgery. You just go, it's, guys, if you can avoid surgery and avoid medication, do it. Try everything before you go that route. Now, this poor woman did try a couple of things. She went to the wrong doctors. Anyways.
So keep seeking. I think that's before you do something that's irreversible.
Yeah.
Right? Because in reality, any of those surgeries, they can revise, but it is irreversible. There's some things you can't come back from. And yes, often more conservative treatment takes time. It takes sometimes more time but I don't think it takes more time than healing from a surgery or multiple surgeries that you may have to have down the road. And that's part of the issue too, is a lot of times one leads to another. It's not like they put the spine in proper alignment before they fuse it. Mm-hmm. Often you still are dealing with
her neck leans.
Yeah, it's improper. It's improper positioning.
And now it's fused, so it's stuck like that.
Gosh, and now the muscles have to compensate for that. They have to, it's not just one thing. It's not just 1 or 2 segments that they're impacting. And now, I mean, think about being in pain that long and how that impacts her spouse.
Anyway, it says Ms. Frommer's surgeon did not have time for a longer discussion. She was prepped. That right there is very sad. So the surgeon goes, I don't have time to discuss this. Let's put you under. She was prepped for surgery the next day. DNR was suspended for a time. Surgery went smoothly. Ms. Frommer never knew there were other options. So anyways, it goes on to talk about this, that in the operating room, even if someone has a DNR, they suspend it and they resuscitate people because hospitals, so here it is, national data banks track surgical mortality, which can reflect poorly on hospitals and on individual surgeons. For both personal and professional reasons, surgeons may not want to operate on someone who could die a preventable death.
I have a solution. Why don't we have a separate category for people who die with DNRs in surgery? It's not rocket science, people.
Yeah.
We're blaming
Right.
We're blaming these decisions or the way the system is, which is radically broken because we're taking away patients' decisions for their health and their life. And these are easy fixes. Like it's not rocket science to change how you record numbers. It's not hard.
Yeah. Yeah, I understand. At the same time, if the surgery caused them to code, that still looks bad on the doctor, so they don't want that on the record either. Even if they were resuscitated or not resuscitated because of a DNR.
Well, we already record errors.
It says today, Miss. Well, right, I know. But the problem is, I think hospitals are so concerned about brushing things under the carpet and,
because of malpractice,
covering things up and avoiding malpractice issues. So it's kind of like the doctor's between a rock and a hard place too.
Yeah, I see that, but it's part of the risk that you take on when you decide to be a physician.
Right.
So when you make the decision to do that, you are putting a patient's life in your hands. So guess what? You are going to have times where you succeed and you're going to have times when you fail. So don't fail as much as you succeed. Make that decision and do the right thing every time.
Well, and then it also bothers me because it said here sometimes they don't want to do surgery on someone who could die. But I go, okay, what's the basis for your decision? What's your intention?
Right.
Anyways.
Is it now? I understand not wanting to put somebody through a surgery if the likelihood is that they're going to die on the table. Right. I 100% get that. However, again, is it not the patient's decision to decide if they want to take that gamble?
Yeah.
It 100%
like we have a
be.
91-year-old patient. Like, didn't she just have knee surgery?
Mm-hmm.
91 years old. She just had knee surgery. We have multiple 91-year-olds actually. But you go, okay, so someone might have said, a surgeon might have said, she's 91. This is big risk. Put her under anesthesia, doing surgery. She may not come back. But if we don't do the surgery, what's her quality of life?
Correct.
So what do you do?
And this is an active 91-year-old.
She is, yeah. She is. But I did not like the way she was walking.
Yeah.
Because of that knee pain. Anyways, it says, today Miss Cooper still shakes with anxiety. Her family provides much of her care. This is the one that was in hospice.
This is the first one.
First one,
story.
yeah. Because they can't afford full-time caregiver. And Miss Cooper hasn't regained her trust of doctors.
Why would she?
They interfered with me and God. That's sad.
But I will say this. If God really wanted you to go, you'd be gone too.
That's
Do you know
true.
what I mean?
Yeah.
So let's not
She
take
said,
God's power away from.
I was ready to go, and they took that from me. Her daughter, Miss Uphold, has contacted dozens of lawyers in and out of West Virginia, but no one has taken the case. Most DNR violations are difficult to litigate, whether or not the patient dies. Lawyers typically calculate medical malpractice suit damages through lost wages, but older adults usually don't work, meaning that method of determining damages fails to account for their pain and suffering or death. So they can't put a dollar amount on their pain and suffering, so they're not taking the cases. It's cheap to kill sick old people, said Thaddeus Pope, a law professor and expert on end-of-life cases.
It's sad that we even need an expert in end-of-life cases.
Mitchell Hamlin School of Law in Minnesota. Minnesota has a lot of problems. No, nor are there many legal consequences for keeping them alive against their will. So there you have it.
just sad.
You can't
We
save their
told you
lives.
it wasn't going to be
and
an uplifting
You can't
episode.
save those lives, and you can't let them die. Anyways, just so that there you have it. I mean, the DNRs are not clear cut, black and white. Easy to interpret. There's a lot to it.
But you can writing down what you want and
Yeah.
making sure that you have your family members have that and you have that on your persons. And if you are in an emergent situation, that your family can speak on your behalf and let patient, like when we went in for our birth plan, to have our kids, I had a very specific birth plan. And so I didn't just hand them the paper and go, do your best. I said, these are my non-negotiables. This will happen the way I'm telling you to, or we're going to have a big problem.
Right.
And that I kind of went in like a bulldog right off the bat. That was super, super, super important to us.
Yep.
So don't be afraid to advocate for yourself. That is absolutely a necessary thing that we have to do in any situation. Don't be afraid.
Right.
Do that.
Not just regarding DNRs, like Brandy said, with everything. Whatever your wishes are, do that. Say, I don't want this, I don't want that. I don't want general anesthesia. I want local anesthesia. Whatever you decide. Afterwards, do not give me opioids. I have, how many people have addictive tendencies and they get injected with opioids against their wish, and now they're back to being addicted all over again.
Exactly.
So that it happens a lot. We got to be careful. We got to make sure your wishes are known. Tell everybody, constantly tell every nurse. When nurses change, just tell them again. They have boards in the
Make
hospital
them write it on the
rooms.
board.
Make them write it on the board. Yeah, whatever you got to do, make sure your wishes are upheld. And you know what? I just pray you never end up in that situation. I want all of us to live a full, active life and then just drop dead.
That would
Not in a hospital.
In a perfect world.
Yeah, just boom. God. Anyways, not that I wish for anybody to drop dead, but I just
Hopefully you're going to a better place.
You're definitely, yeah,
So.
yeah, and the fact of the matter is, it just seems like our medical system doesn't prolong life; it prolongs death. It makes death grueling, longer, and more horrible and more painful when it should be a quick thing. It's a transition to the afterlife. So,
exactly.
anyways, bless you guys. Stay out of the hospital. Don't take unnecessary drugs, and come back in a couple days for another episode.
We'll see you next time.
Live radio, local podcasts, the Frederick Podcast Network at listenfrederick.com.